My name is Dr. Shelley Harkins, Shelleyharkins. I am the Chief Medical Officer and President of the Regional Medical Center at St. Peter's Health in Helena, Montana. Today, I want to share with you that we are now seeing volumes and resource constraints that require St. Peter's to shift to crisis standards of care. A situation that we don't take lightly in healthcare. In fact, for the first time in my career, we are at the point where not every patient in need will get the care that we might wish we could give.
Jeez.
It is not business as usual at your local healthcare system. Over the past 3 weeks, we've seen anywhere from 15 to 22 patients in our ER or hospitalized with COVID-19 at any one time. Our ICU is 100% full, and our advanced medical unit is 100% full, meaning our critical care resources are at max capacity. On Sunday, I received a phone call from our administrator of the day, or our house supervisor. Our morgue is full. What do we do with the next body? For the first time in this pandemic, we face the reality that we're going to need to bring in additional morgue support. And what that actually means is a freezer truck in the parking lot. I know that I'm starting this conversation with perhaps the most morbid, hardest thing to hear. So I want to take a step back and set the foundation for our conversation and paint the full picture for you. I want to emphasize that while what I share today will surely be difficult to hear, there are so many important things to know and some bright spots. First and foremost, do not delay medical care because of what you're hearing today. We are still very much here to provide care for our community, and we're doing absolutely all we can to keep all services open. True emergencies will always receive priority. Outpatient care in our clinics, preventative care, emergency care, it is all still available, and it is very safe for you to come and receive that care. So please seek the care you need to stay healthy. Do not stay home because you believe we are too overwhelmed for your condition. You matter, and we will do all we can to help you. Second, crisis standards of care and modified care have the potential to impact everyone, not just those with COVID-19. All patients will see a different experience at St. Peter's Health at this time. The things that we are describing don't impact every patient every time. Our capacity literally changes by the minute. Sometimes we do have the staff and the space and the equipment and the medication to give every one of our patients at that time the care that we want to, the care that they need. Other times, maybe the very next hour, we do not. Fourth, the community needs to know that by almost every single measure, we are in a far worse position than we ever were in the winter of 2020 during our first surge. This surge is different, and I'll share some of the reasons why. These are some examples of why the surge is different and what scarce resource allocation and crisis standards of care actually looks like in healthcare. What you may experience at St. Peter's Health and in most hospitals across Montana and the Mountain West at this time. Many patients who are critically ill with COVID-19 require substantial oxygen support delivered through devices like heated high flow, BiPAP, V60s. These are what we use to deliver high volumes of oxygen before resorting to ventilation. Most of these devices require continuous monitoring because patients have unstable vitals. Continuous monitoring means our caregivers have access to those vitals, like oxygen levels, from the nurse's station, so they can keep a remarkably close eye on patients all the time. But now, the current situation requires us to provide oxygen without those eyes on continuous monitoring due to bed shortage, staffing shortages, a host of reasons that we would have to have a patient outside of the space that we would normally be able to do that in. Critical care is best provided inside a critical care unit. We are providing critical care outside of those usual units now. Devices that used to be used only in the ICU with continuous monitoring are being used outside of the ICU now. This is risky, but the alternative is the patient doesn't get the oxygen they need and they die. That is scarce resource allocation. That is crisis standards of care. By the time someone is hospitalized due to complications from COVID-19, we are relatively limited in what we can do for them, apart from delivering supportive oxygen care. There are some medications. We will call them MABs for short, because many of them end in MAB. So MABs, they are approved COVID drugs, but we are on allocation for it. That means that we only receive a certain amount of the drug and then cannot get any more no matter how much we use. Earlier this week, we had enough of the medication to treat one patient with a full course, but we had multiple patients that qualified for it. Do you give it to one patient? Do you split it among multiple patients, giving only partial treatment to everyone? Do you give it to just one patient, the lucky one, and let the others go without entirely? We have decided to partially treat patients to spread that scarce resource further. Earlier this week, we ran out entirely of some key drugs, and we had to wait for our allocated shipment to come in, not knowing exactly when that might be. Therefore, through that time, no patients got the medication. This is scarce resource allocation. This is what crisis standards of care looks like. Williston, North Dakota, Lewiston, Idaho, Hamilton, Utah, Texas, Washington. Our phones are ringing off the hook from these places. On the other end are clinicians desperately looking for beds for patients who are very sick and dying on gurneys in their halls and ERs. There are not enough beds in the Mountain West to serve the need. This is our reality now. Deciding if we say yes or no is really difficult. It's easy enough to say, we're going to hold Montana beds for Montanans. But it is much harder when you put yourself in the shoes of a crying emergency room staff member on the other side of the phone who is desperately trying to find a bed, simply calling a list of hospitals they've never even heard of before, like they're looking for a plumber, and hearing no over and over, and then having to go talk to the family and tell them, we just couldn't find you a bed. What if that was you making the calls? What if that was you or your family who could not find a bed for their loved one? That is happening. That is scarce resource allocation and crisis standards of care. The flip side of that is that when we have a patient at St. Peter's Health who needs a higher level of care than what St. Peter's Health would normally provide, there is no hospital to take that patient anymore. We have to do the best we can to care for that patient. This is crisis standards of care. Our hospitalized patients are having to be discharged sooner than we might normally discharge them and have their families continue the care for them at home because we have patients waiting in the ER, in the hallways for that bed, patients who need the bed more. That is scarce resource allocation. I could go on and on with examples of how the experience for all patients changes when we are in crisis mode and under allocation, but I do want to end there and hope you are realizing the gravity of the situation and shift to examples of why this time is so different. I think that is a common misconception. Why is it so different this time? Well, this is why. Patients are sicker. The Delta variant is causing people to be very, very sick. These patients are on extremely high levels of oxygen support and require continuous bedside support and monitoring. As respiratory therapist Brian Jensen shared a few weeks ago, many patients are on levels of oxygen that are like a fire hose, 80 liters or more. This stresses our oxygen delivery system and is very challenging for the patient to even handle. Some states are out of oxygen, as an aside, as you have probably heard. We are fortunately not there yet, but we might get there. Removal of a patient's oxygen mask when they require levels of oxygen like this for even a moment, to take a bite of food, for example, can result in immediate drops of their oxygen status to life-threatening levels. Further, we've been delivering care types that we have never delivered before due to our inability to transfer critically ill patients to higher levels of care. For example, we've leaned on telehealth, our partners at the University of Utah, to help us prone critically ill patients, basically flipping ventilated patients onto their stomachs for hours at a time to help them with oxygenation as a last resort. This is a very risky process. It is typically only done in university settings, something we've never done before at St. Peter's Health. But there is no alternative. We have to do those things here now. There are no beds at other facilities. Our team has really stepped up, and they've done an absolutely remarkable job. And in doing these things that they have never done before, we are saving lives. Patients are younger. The other day, the average age of a patient hospitalized due to complications from COVID-19 at St. Peter's Health was 47. The average age, 47. One of our nurses said something that really stood out to us. In this wave, we're caring for patients that are often younger than we are. Another nurse said, we used to be coordinating care with adult children of patients. It was the grandparents. Now we're caring for patients with 1 or 2 year olds at home, and we're coordinating FaceTime visits with their toddlers. Do not think that this can't happen to you. We have seen younger patients with no comorbidities, otherwise healthy, spend time in our ICU. People in their 20s, 30s, 40s. We say ICU so casually now in the news stories, but think about it. People in the ICU are so critically ill that a nurse is literally dedicated at the bedside, keeping you alive every second. You are terrified. You have no family or loved ones that can come in and see you. And nobody around you, not a doctor, not a nurse or otherwise, can tell you if you will make it or not. We are more short-staffed this time around. This is a big one, more short-staffed. We think that anyone in any industry can understand this right now. You see it everywhere. Workforce challenges. We are not immune to that. We continue to hire traveling staff as they might be available, but there is this time around a serious supply-demand issue for qualified healthcare professionals. We are working short-staffed in every single department. Our nursing leaders are serving now as nurses. People are working extra shifts. People are working outside of their departments and doing things they've never done before. We are providing more non-acute care COVID-19 related services, monoclonal antibody treatment, vaccinations. We talk a lot about the impact of the pandemic on the hospital, on inpatient care, but there are so many other services we provide that we need staff for that help keep people healthy and out of the hospital. In this wave of the pandemic, we are also staffing and providing new clinics, new services to provide the infusions to keep people out of the hospital, to provide the vaccinations that keep people out of the hospital. And so we're even more short-staffed. We're doing more with fewer people. We have caregivers stepping up to spend their shift solely spending time around and caring for people who are sick with COVID-19. We are also dedicating staff and resources to the vaccination effort, and as mentioned, continuing to ramp up the COVID-19 testing again. We're giving all we've got to the infusion clinic, and it is not enough. Not everyone is getting what we wish we could give them. We're dedicating everything we've got to testing, but it is very difficult to get a test right now. It is not enough. Dedicating everything we have to vaccines and it is still not enough. We are having to tell some patients, you are not going to get what you need. And that is very challenging. This wave is impacting the entire nation, making resources more scarce and the ability to transfer patients to where they may need care rarer. As we shared above, academic medical centers that can provide exceptionally high levels of care have waiting lists for COVID-19 patients that are pages long. We triage calls from around the region looking to us for beds. Last time, with the first wave of COVID, transfers were sought at times within our state, but this has become a regional, national issue that the Mountain West did not feel before. Our staff are tired. They are grieving. They are frustrated. They are doing their very best, and they are doing a good job. But it is a struggle to give everything you've got, and at the end of the day, to know that it was still not enough. Working in healthcare right now is challenging. This is the most challenging time in my entire career. Decision fatigue is real. Real fatigue is real. One of our nurses shared something interesting the other day that we thought was powerful and describes the psychological impact of this wave. We'll call it the kid factor. In the first wave, with the other variants, our staff were not caring for very many kids who were severely impacted by COVID-19. Of course, the fear of bringing COVID-19 home to their family members and their children was still very real. But now we are seeing very sick children. We trust our PPE, but we ask that you put yourself in the shoes of a nurse who has cared for COVID-19 patients for 12 hours. Imagine how you would feel coming home after that 12-hour shift to your young children. We are seeing children who are struggling to breathe and who are very sick from COVID-19. The first wave did not impact children that much. This one does. It is a really important message. This one is affecting our children. This is not an easy time, but if you take anything away from what I'm telling you today, please have it be that our staff, through it all, are giving their all for this community, and we owe everything to them. So what are we doing to make things better? Where are the bright spots? We are now offering the monoclonal antibody therapy to keep people out of the hospital. It's not always effective. It's not available to everyone, as we've discussed. We do have staffing limitations and we're on allocation. But we're ramping up our clinic as fast as we can, and there's mounting evidence that this infusion will help eligible patients stay out of the hospital. When we talk about scarce resource allocation, this is a great example. We've applied for and received a waiver from CMS. We just found out that the waiver has been approved just yesterday to adopt modified public health crisis order sets for our nurses. In layman's terms, we are giving our staff permission to not do it all. The hardest thing they'll do in their careers is to not give all the care they're used to giving, but they simply can't. For example, you want to be able to bathe your patient when they want to be bathed or when they need to be bathed. That can't happen all the time anymore. Our staff are used to giving an exceptionally high level of care with meticulous documentation. They can't do all of that anymore. Their priority is keeping people alive, and this new order set will help them focus entirely on the most meaningful tasks at hand, but it does represent a deviation from what used to be standard of care. This is crisis standards of care. We are still asking our community to come work at St. Peter's. We need to fill our positions. We need people willing to work in healthcare. And we're hiring staff as quickly as we can and as they are available. We've also requested National Guard support. At this time, we are not sure that we are going to be given any National Guard support for a variety of reasons, but we do have that request there. And then lastly, We have reallocated staff to different roles. We have hundreds of staff every day doing things that they did not do before, that they were not necessarily trained in, but were willing to very quickly become trained in it. Again, the biggest take-home message is what our staff are doing for us and how they are stepping up. Lastly, we can't do this alone. We need the community's help. Number one, take preventative health measures directly related to COVID. We know you're sick of hearing it. We get it. We're sick of saying it. It has been 18 months, but I do have to say it again. Get vaccinated. The vaccine works. It's safe. Neither of those two statements are questionable. The vaccine is safe and it works to keep you out of the ER and the hospital. The vaccination remains our number one best tool in the fight against this virus. Please get vaccinated. Next, mask indoors in public. The community hasn't gotten the memo on this one. Do it regardless of vaccination status. Please, we need your help. Stay home if you're sick, unless, of course, you're seeking medical care. That is a difficult message to understand. Stay home if you're sick, unless you're seeking medical care. If you feel you need to see a physician, come to the hospital. But if you know your diagnosis, if you aren't feeling that bad and you know you're sick with COVID-like symptoms or you know you have COVID, stay away from others. Take other preventative health measures. When you're recreating, wear a helmet, know your limits. Take care of yourself by managing your chronic conditions like diabetes and heart disease. Get the preventative and outpatient care that's still readily available so that you don't have a traumatic accident or an exacerbation of your chronic condition and need to come to the hospital. Choose kindness. We hope that some of you are shocked to hear that every day that staff that I just told you were stepping up and doing the unthinkable, the true heroes, they are verbally assaulted and sometimes physically assaulted every day. They are yelled at, cussed at, spat at. They have things thrown at them, all because they don't want to wear masks or they don't agree with our visitor limitations. Our priority is keeping our staff and caregivers safe. The precautions are in place to protect them, and we hold this a sacred responsibility. We understand that you are frustrated and stressed and simply sick of it. But please choose respect, choose kindness, and support our health caregivers. We are all in this together, and together we will get through this. That concludes my statement. Thank you. Any questions?
Yeah, Dr.
This is,
Hawkins, this is Ed
Go ahead.
O'Brien over at Montana Public Radio. Sorry, thank you. Two questions. First one, is St. Pete's the first to officially adopt crisis standards of care in Montana? Is that accurate or is that not accurate?
Well, it's not accurate. We talk very frequently with the CMOs from all hospitals, and we are all experiencing this in the last couple of weeks. Flipping the switch to say crisis adopted, it's more of a phased approach. There are elements of crisis standards of care that we are all already doing and experiencing. There are other elements like oxygen is not yet a scarce resource. Other pieces of it that we are not having to deal with. So it's not really a flip the switch kind of thing. It's more of a gradual increasing crisis mode. And that has been the experience for all of us. We know that other hospitals have talked about crisis. They've certainly alerted the community. We're going a little further to truly paint the picture because we don't want any of our community members to be surprised. In the last several days to a couple of weeks, we have had families that have said, we had no idea. If we had known it was this bad, we probably would have been vaccinated. We had no idea that even though we have insurance, we might not get a medication or a full dose of what we need. We just didn't know. And that's really what has driven the decision to make a statement as bold as we are making. The community needs to know. And if they do need hospital support and resources and care, that they are not surprised by their change in experience.
And second question, Billings Clinic's announcement yesterday drew a lot of interest from our listeners. And I noticed online a very common question or statement maybe would be, will or do vaccinated and fit patients take priority for care? And I thought I'd just pitch that to you for an official answer.
Absolutely not. Vaccination status is not relevant to us when it comes to taking care of patients. We simply do what they need us to do within the constraints and the resources that we have. In fact, it might be interesting to know that oftentimes we have cared for a patient, we've gotten them through their initial crisis, we've moved them to a bed, we've started medications and oxygen, and then find out whether or not they're vaccinated.
Thank you very much.
Dr. Harkins, this is Nolan Lister from the Independent Record. You seemed doubtful that support from the National Guard would come. Can you expand on that a little bit? Why are we a little doubtful?
Well, this time around, the National Guardsmen all have jobs, as I understand it. The last time we were on lockdown and many people were at home and were not deployed, but this time around it's business as usual out and about. You can walk around and see that everyone's back at work. That includes our guardsmen. So I think that is one reason they're not as available. Another reason is that the fires are still very much an issue and taking a lot of those resources. And then, of course, not all guardsmen can work healthcare kinds of jobs. And so I think those three things, that's my understanding of why guardsmen are not as readily available this time around.
But you folks have made an official request for that?
Yes, we have. We have officially requested that through all official measures and have confirmed receipt.
Thank you.
Jordan Johnson with KTVH here. Can you kind of tell me what people who are not diagnosed with COVID-19 should expect when they go in to receive care from St. Pete's?
Sure. If our wait times in the emergency room are increased, the emergency room has seen record volumes over the last month or so. We continue to break records, and I'm hearing that from hospitals across Montana. If you do need hospitalization, we have almost daily boarded patients, meaning they need a hospital bed, but because we are waiting for one to open, they actually receive their hospital care in the emergency department, which is not nearly as comfortable as a private hospital bed. And so we have inpatients still in the emergency room for hours to days. That's just two examples of what they might experience.
And then you kind of
Dr. Harkins.
You can go
ahead. Dr. Harkins, this is Nolan Lister with the IR again. You mentioned that in addition to finite resources, that staffing was stretched thin as well. How, could you maybe put a finer point on that? Just how short-staffed is the hospital?
Yeah, that changes shift to shift, but it's not just nurses and clinical staff. We also have food and nutrition resources, EVS resources. So just to describe a typical scenario, and one of the reasons our nurses are just spent and unable to take extra shifts is because in addition to dealing with very sick patients and very angry families and really difficult times taking care of more patients than they usually do, they are having to clean rooms because we don't have EVS staff to clean rooms. They're having to bring food to patients and order their meals for them because we don't have nutrition staff that can do that. So the burden for any one staff member to take on other roles, to do other jobs, that's what we're seeing. We're short-staffed everywhere, just about every day, and the reasons are many. Number one, we've got staff that are burned out and they simply can't take extra shifts, or they just need a break and can't even do the shift that they were signed up for. Absolutely understandable after 18 months of this, and here we are after 18 months at the worst it's ever been. Number two, we have a lot of people leaving healthcare. They are leaving the workforce, period, because they have to stay home with kids. Because of the variety of reasons, all of us know the workforce is a problem now. That is an issue for us. But they are leaving healthcare specifically because it is so challenging to work in healthcare right now, where everyone is strained. We also have 200 open positions. Even coming into COVID this time, we have 200 open positions out of our 1,700 member organization that were never filled because Helena really is tapped when it comes to healthcare resources. Very difficult to get licensed professionals into some of these roles unless they already live in the area. And so we were already short. So those are just some examples of why we cannot get our staffing where it needs to be. You know, we're a 99-bed hospital, but we have not been able to staff all of our acute beds in months. So what is full capacity for us is related to staffing, not so much bed space.
And just a follow-up question, if you guys don't mind. You said that you know, you're trying to hire travel nurses as they become available. Is there any other steps that the hospital is taking to maybe make some more hires? Maybe increasing pay, has that been considered? What sort of other steps are being taken?
Yeah, regarding the travelers, I'll start there. One of the phenomenons of this pandemic is that traveling nurses, the pay for traveling nurses and traveling staff and techs has increased astronomically. And so we are paying premium prices across Montana and everywhere in the country for traveling staff to be able to keep our services open. That is very demoralizing to the staff member with tenure that has been here through it all. It's doing the exact same thing their traveling partner is doing. When they see how much more money that traveler is getting, it just further demoralizes them, understandably. And so it's a tricky situation. We've got to have the staff, but paying the prices for that staff right now harms our current staff. Increasing everybody across the board to those dollars is completely unreasonable, unfeasible. We just could not stay open. But yes, to your point, we actually met as a leadership team the day before yesterday to spend the day talking about nothing else but pay, compensation, benefits, packages, making sure that we are highly competitive and attracting the best of the best across Montana and into the Mountain West.
Thank you.
Do you have an average age of the COVID-19 patients that you are seeing now? You said that 47 was what it was before.
Yeah, it was, correct me if I'm wrong, Katie, but that's when we looked at it a few days to a week back. it's something we just need to pull manually. And I don't think we've looked at it since then. We just got a snapshot in time.
Yep, snapshot in time. And I think it has gone up slightly based on the ages of some of the folks that we've admitted recently. So I would say it's a little higher now. But 47, it was a snap and shot in time at 47 for that day that we looked at it.
Okay, great. Thanks. Just wanted to clarify.
Does anybody have any additional questions or clarification on anything that you've heard today?
Yeah, I guess one quick follow-up question. I'm just kind of looking through my notes right now. These MABs, the COVID medications, it sounds like we are woefully under allocated those medications. Any idea of the future outlook for that?
That is a great question. The allocation is to ensure everybody gets some, not to ensure everyone gets enough. Now, having said that, as I understand it from our pharmacy experts and folks who really understand the process, the more we ask for it and the more we demonstrate we are using it, we can increase our allocation amount. And we're doing everything that is available to us to make sure it's clear how much we are using. But at this point, our allocations have not changed.
And then with the oxygen supply, you said we're getting pretty close to dangerous levels of oxygen supply.
At this point, we are not. We are keeping an eye on that closely because other states have run out of oxygen, which obviously, when that is the one and only thing other than the MABs that we can do for patients in the hospital, you can imagine that's the next rung of crisis standards of care for sure. But at this time, Montana is sitting in a very comfortable position with oxygen, and St. Peter's Health is as well. But the levels of oxygen that these patients are requiring, 80 liters all day long for days, that puts a grand strain on oxygen. So it is something that we can't take our eyes off of.
Okay, thank you for that clarification.
Absolutely.
And then as we wrap up here for the local folks, I know, Edward, you're on the line as well, but if you're able and are going to turn this story today, just as a reminder, we have the drive-through vaccination clinic tonight from 5:30 to 7 behind the Broadway clinic here in Helena. We'll have a few Johnson & Johnson doses left, as well as Pfizer and Moderna. So we'll be able to service anybody 12 and over. So as what Dr. Harkin said, big takeaway there, please come get vaccinated. If the story is going to run later, the County Hub site has great information on available vaccination resources, and you can come to St. Peter's Health Broadway Clinic any day between 8:30 and 4:30. Walk in, no appointment needed, no cost to receive a COVID-19 vaccine.
And with this clinic today, the drive-through clinic, is there appointment
Nope.
needed or no?
No appointment.
Okay, thank you.
I'm really grateful that you guys gave me the opportunity to tell our story. I do just want to emphasize again that with the first surge, we did see an increase of deaths at home. Patients that were afraid to come to the hospital, either because they were afraid of COVID, afraid that the hospital was not safe, afraid that we were too overwhelmed and that their chest pain or their stroke-like symptom would go away. And for a variety of reasons, the increased rate of death at home was quite alarming. And so St. Peter's Health and healthcare systems across the nation are timid to put the community on alert because we don't want that to happen. So I just plead that of all the messages, the two most important ones are got to protect our staff. Please be grateful for them, lift them up, show them gratitude, understand that they are heroes. But a very close second, if not a double first, is please come to the ER if you are having an emergency. Don't stay home.
All right, if nobody has anything else, you guys have my cell phone number. Please reach out with follow-up questions if you have them, or any clarification on statistics or anything that was shared today. So thank you for jumping on.
Thanks all very much.
Thank
Thank you.
Thank you all.
Thank you.